National Hearing Care began in New Zealand in 2008. We bought 3 small practices. One was in Auckland, one in Hawke's Bay and one in Gisborne. That was what you might term as the cornerstone for our operations in New Zealand. We quickly then expanded through what they call organic growth. What that means is that you're opening new clinics, brand new fresh clinics in new areas. So we quickly grew to 16 clinics, and we have plans to open another 6 clinics in the very near future. So we're very much an expanding clinic network. I like to think that National Hearing Care is a slightly different organisation in the way it approaches how we do what is essentially an extremely important service for the clients that we have. We put customer service first and foremost. It's very, very important to us to make sure that the experience that our clients have with us is the best they can have. But at the same time, what we have to be able to do is to show and demonstrate that we have a very strong clinical aspect to what we do. At the end of the day, we're diagnosing a hearing loss and prescribing the best solution to the client's needs. By offering a free hearing screen, what we're actually doing is we're able to get the idea of perhaps thinking about hearing health into somebody's consciousness perhaps earlier than they may have if they just sat there waiting for their hearing to deteriorate to such an extent where family members were complaining so much that they felt they had to do something about it. So we've had a lot of feedback from our own clients to suggest that they're extremely pleased that we actually did make that contact, that initial contact with them. And had we not done that, they think it would have been many more years before they'd actually done something about their hearing health. We try and ensure that everybody is treated in such a way that they feel really comfortable about coming into one of our clinics, feel welcomed by the staff that meet them, our customer service officers, all the way through to them meeting the audiologist. It's all about, one, treating you as an individual, but secondly, recognising that actually you might be a little bit nervous and a little bit apprehensive about actually starting to come to terms with the fact that you may have a hearing loss. So we take that responsibility very seriously, and what we will try and do is walk you through that process very gently and get you to understand more about what perhaps caused your hearing loss and then what we can do to then support it later on. We have a customer survey form that we give every one of our clients that comes in for either a full diagnostic test or is prescribed with hearing devices, and we're extremely proud of the results that we've had from this test. 98% of all the clients that we have carried out these tests for have said that they would recommend National Hearing Care to their friends or family. The other 2% actually, when we clarified it, ticked the wrong box and would have in fact recommended us to their friends and family. So we are very proud of this statistic.
Couldn't hear the phone ring. And most of my friends don't like leaving messages. So they have to ring me back. Then when things started getting on my nerves about having to have people repeat themselves all the time, that was getting on my nerves. I could do something about it. Yeah, I think I got a call from their office, the clinic. So I spoke to the receptionist and she said there'll be no costs involved. Everything sort of fell into place. So I thought once I got my hearing aids, I'm handing on my good fortune to other people who I know are sitting in silence, like I was, more or less, you know. But to be able to hear the birds sing and a lot of noises I'd forgotten all about. I've stood out here several times and just listened. I was missing all that for years. I was and still am over the moon about the help.
I was convinced I didn't need hearing aids. I was complaining that my wife was always talking so very quietly. One day she got so fed up with me that she got an old hearing aid and come out and popped it in my left ear and said, "Now listen to me what I'm telling you." And so I had to confess that it might be worthwhile. So we went down to Henderson to the clinic there and saw Karen, and she's looked after me very well ever since.
It's been a great improvement, it really has. I would urge anyone who has a partner who isn't hearing well at all to really do something about it, because it makes all the difference to your day-to-day life, quite honestly. And I'm so impressed with them that I would definitely recommend them to my family and to my friends, and without any hesitation at all. Yes, they're excellent.
We believe we have a world-class client management system. This is a system that tracks our clients all the way through from the very moment that we make a contact with them through our contact centre, all the way through to prescribing hearing devices. It's so integrated into everything that we do at National Hearing Care that any of our clients can travel to any one of our clinics and be able to pick up their prescription, their ongoing management, just as though they were visiting their home clinic. So it's quite important if you're travelling or you have an emergency, you can then visit one of the other National Hearing Care clinics and have peace of mind. And that's something that we think is very important, that all of our clients should have peace of mind with National Hearing Care.